Doctors, therapist of Reddit. Do you have any that's not normal stories? If so, what abnormal habit oddity did the patient have thinking it was normal? I was the patient. But when I went in for a routine physical, the doctor poked my extended belly and asked how long it had been like that. I laughed and said, "What? My beer belly? Oh. Since I was 21 probably." Turned out that no. The beer belly was a cyst that had grown really large, and that was why my friends kept saying I looked pregnant. I thought I just had really shitty friends. Had to have emergency surgery, and for a week or so they did not know if it was a cyst or ovarian cancer. It was a pretty big scare. Believe it or not. This also happened to me. I found it because I became pregnant and they saw it in the ultrasound. Also had to have an emergency surgery and I lost 32 pounds that day. I always just thought I gained weight weird or something. This was a time I was told something I did wasn't normal. I was in physical therapy recovering from a back surgery. My in-home physical therapist was having me do stretches and asked me to extend my leg as far as possible and straighten my knee. So I do this and my knee inverts. Which to me was totally normal. But my PT was very surprised. She explained that was very abnormal and she had not seen hyperflexible knees like mine before. So now I know my wonky bird's knees are not normal. You might have Ehlers-Danlos syndrome. I'm hypermobile as well and my doctor suspects I have it, although that requires genetic testing. If you have soft, stretchy skin, you dislocate easily, or pain, you should see a doctor. Yo, if it ever really started bothering me I would. Currently it's mostly just interesting. Until that PT about 3 years ago I thought everyone was like that. O. Capital O. I was the patient. I had no idea that it wasn't normal to uncontrollably sob for 2 weeks out of every month. Have breasts so sore I couldn't go downstairs, jiggle. And then have it all stop the day you start your period. It took me getting a female roommate at 30 for me to realize that wasn't typical. I asked my OB-GYN after charting my symptoms for 6 months. PMDD. A depressive disorder that is tied to your menstruation. A change in birth control pills fixed it right up. He also looked at me like I was crazy for thinking that was normal for 16 years. I asked my mom after my diagnosis. Oh yeah. Remember in high school? Your friends would come over and ask if you were crazy that day or not? No mom. They didn't ask me that. Thanks for letting me know. Guy in his 20s came in complaining of belly button problem. I examined him. He had an irritated scab inside the belly button caused by aggressive limb picking. But dude was sweaty and had a slight tremor. Looked like crap. When I asked how he was feeling overall he said, "Oh okay I guess. Just a little tired. Drank a little more this week than usual. Probably overdid it." I had to pry for details and turns out he drank a gallon of gin over the last 3 days and stopped drinking alcohol when he started vomiting large amounts of blood and pooping a mixture of bright red blood and dark sticky stuff, melina digested blood. He was totally unaware of the fact that he was going through alcohol withdrawal, sweating, shaking, because he hadn't stopped drinking long enough in recent memory to experience symptoms. They sent him straight to the emergency room, where they found a tear in his esophagus that required immediate intervention. And he was admitted for inpatient alcohol detox. I read his hospital note. He still insisted that the ED doc examine his belly button. A pimple on her breast that was actually a 4-inch wide. Bleeding and necrotic breast tumor protruding through her skin. Oh, that's sort of like me. I thought I had a pimple on my back. Until it shot out what I could only describe as moldy old cheese mixed with cream of chicken and blood. Wasn't necrotic as far as I know. Just an abscess. The smell is indescribable. I'm sure you, as I assume, a medical professional, know what I mean. I'm a therapist and a couple came in and were fighting because they didn't want to have sex. I told them they didn't have to. They were fairly confused and thought I was lying to them. Now they have 3 kids. Reverse psychology, eh? When I finally got on medication for my anxiety, I found out getting irrationally angry and frustrated almost to the point of crying and screaming at people for touching things certain ways. Putting the dishes away wrong. Chewing. Moving my stuff a few inches or talking to me when I didn't feel like talking was, in fact, not normal. Thank God for Prozac. I didn't realize that regularly having a bad feeling about this or feeling guilty even though I did nothing wrong wasn't normal. After being medicated for most of my adult life, I can clearly see I had anxiety all the way through my teenage years. Not a doctor, but when I was maybe 14 or 13, I remember describing to my primary how during my periods I would pass out from the pain, couldn't move, or I would get sick, and told her a story about how I went on a trip to Italy and sometime in the middle of the flight became wildly sick to the point of terrifying the poor flight attendants. I'm so sorry, flight attendants. By filling 4 puke bags, crawling to the back of the plane clutching my stomach, finding the doors locked, attempting to use the first class bathrooms so I could finish being sick. When denied entry, just lay down in the aisle waiting for sweet death to take me. It did not. Death has terrible customer service, and then passed out when we exited the plane. But periods are supposed to be painful, right? The doctor was like, honey, you're supposed to experience some discomfort, not be incapacitated anyway. She put me on birth control and I've never been happier. I'm a patient who thought it was normal to have a headache nearly 24/7. It was actually the occasional absence of a headache that I initially believed to be problematic. That's freaky. Did they ever find the root of the problem? Yeah, it's likely one of the symptoms of my genetic disorder. My disorder is so rare that if I name it, it may make me less of an anonymous Redditor. Thankfully, headaches don't really have a significant impact on my quality of life overall. Not a doctor, but I had an experience like this with someone I slept with. We had just finished and were cuddling when he remarked that he was happy he felt like he was in his body. I looked at him funny and asked him what he meant, and he said, you know that funny feeling you get after sex where you feel like you're not in your body? You're like looking at yourself from the opposite side of the room? Well, right now I don't feel like that. I feel happy instead. I tried my best to not look horrified and I asked him if it was always like that for him. He explained to me that it only started happening after something awful happened to him 2 years ago. I had to do my best to gently explain that no, I do not get that funny feeling and most people don't. I also had to explain, to the best of non-professional capacity, what disassociation was. I feel like my story belongs here even though I'm the patient, since the exact scenario happened to me. A few years back my mental health totally took a skydive. As a result, I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So one day she'd ask about relationships and the next, childhood memories and so on. After a few conversations she focused on my social life. I then told her that it's pretty much non-existent. And it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with the two voices in your head always keeping conversation. But surely she knew that, right? Well, as it turns out, no. Apparently everybody else only have their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. Who TF knew, eh? I read a pretty much opposite story. Young teen girl was concerned because she could hear a voice in her head. After a lot of testing, it turns out it was herself. Her thinking voice, not multiple other voices. She basically freaked out because she was a self-conscious human being capable of being aware that she was thinking. Kind of like freaking out when you wake up and feel a hand on your head, only for it to turn out to be your own sleeping hand. I had a root canal needed in a molar. I went in so he could prep it for the next step. But 2 hours in and he had to call it for the day. So by the 4th 2 hours visit, when it was finally done, I was sick of seeing my dentist. Almost a year later I'm back at the dentist. And he turns to his assistant and says this is the one with that root canal. I'm a legend. Apparently. This happened to me. I woke up with a period so heavy the bed was soaked. Stood up and it just poured out of me. Clots the size of my palm. Overwhelmed, I did what any woman would do, if they could, and phoned my mum to come over and comfort me and help me clean up the mess. At this point I was still thinking this is a strangely heavy period. And I was more worried about how my landlord would react to the carpet. I then fainted. Woke up. Fainted again. Phone mum to cry about my stupid period making me miss work. My parents called an ambulance that arrived to the house first and rushed me to hospital. Not period. Massive internal hemorrhage in the womb. The lady with type B COPD who had long-term cigarette user symptoms. She spontaneously got COPD. Having never smoked in her entire life. How do you determine people aren't lying in situations like this? I know it's not terribly self-serving. But people lie about weird shit at the worst times for bad reasons. Cigarettes leave a lot of shit in your system and it's easy to tell if someone smokes. You know those blackened lungs they show you? Those are just one part of what cigarettes does to your body. One time my therapist told me it wasn't normal to be raised to put other people before yourself. Ugh. My last therapist went on at length. So it is late at night. And a family member is at your doorstep. They are whacked out on drugs. And screaming that they have nowhere else to go. Do you let them in? And I was like, yes, of course I'll let them in. She kept trying to twist the situation worse and worse. But I was like, they are my family. Of course I'll let them in. She sent me to RBN and they straightened me up. Obligatory, I'm not a doctor. Do it. I have celiac disease and am in the process of getting a Hashimoto's hypothyroidism diagnosis. I was the abnormal patient when I was a little kid. Because not only did I get monthly bladder infections, apparently I had to use a catheter for a while, but I don't remember that at all. My doctor was confused why I always had extreme gas, joint pain, and weekly headaches at the ripe old age of 6. Turns out it was just me slowly dying because I ate a lot of wheat bread with celiac disease. Close bracket. Celiac is a nightmare. I was 17 when I was diagnosed. Symptoms can come on super fast too. I think I dropped something like 7-10 pounds. Which on my frame was pretty significant, and that's what got me into the doctor's office first. I'm a patient. Growing up I assumed I was struggling in school because I was just a stupid miserable frick up. I had zero confidence in myself or anyone else. Sometimes I would go days without sleeping. Other times I would sleep all day. I thought about my own death constantly. I truly believed that I was a flawed person and that it would always be that way. Turns out I actually have bipolar disorder. And thanks to medications and therapy, I am a normal functioning human now. Mostly. Anyway, lol. When I was in medical school, I had a mother come in because her son was having behavioral issues at school. He was skipping. Depressed. Didn't take long to find out he had encoprasis. He basically pooped himself without knowing it. Which would be hard at any age. But especially in school. Deep dive. He played Xbox every waking moment with no bathroom breaks. Stretched things out until he lost sensation. And stuff could squeeze out. Edits. Sorry. Late night posting. Swipe. Lots of edits made based on used comments and feedback. I feel really bad for laughing at this. But damn. What about his bladder? Sounds like he has a gaming addiction possibly? This was very much a family problem. Which really covered most of the problems at these clinics. The mother was unable to set boundaries. And she was unable to enforce the boundaries she set. I was fairly blunt when discussing the plan with her. I kinda went through how this developed. I explained it could continue to get worse. I told her I believed he shouldn't have access to an Xbox because it was greatly affecting his health. She agreed. Until he threw a huge temper tantrum. Upon which he immediately caved. I don't remember my exact words to him, but I remember the content of my thought. You are playing video games to the point you poop your pants in the middle of class as a teenager. And you don't want to stop? I am not sure a kid like that had a chance to develop normal. I was the patient. When I was growing up, I had constant stomach aches. Every time I ate, I'd get sick. I went to the doctor multiple times for it, but they could never figure out what was wrong. Eventually, I started to think that everyone lives with pain like that. And I was just being a wimp and couldn't deal with it. I barely ate, such that I was super underweight. I was miserable all the time. I was constantly stressed and depressed because of this problem. Fast forward to grad school. My first year is in China. I'm there for a few months and then, over time, my symptoms disappear. I don't have stomach aches anymore. I gain about 40 pounds seemingly overnight. Now I'm at a healthy, doctor approved weight. My depressive symptoms disappear almost entirely. But how could that happen? What could have caused such a change? Turns out, I'm lactose intolerant. I grew up in the Midwest where pretty much everything has dairy in it, and I'd been eating it constantly for so long. It took months for my system to reset. Being in China where dairy isn't such a staple made all the difference. I felt like such an idiot when I realized that was what was making me ill. On the plus side, I feel better, look better, and I'm a much happier person now. TLDR, constant nausea and stomach aches are not normal. I was the patient, but I walked into an urgent care clinic after I had pushed my teeth through my bottom lip. I was covered in blood and had a large hole in my face. I told the nurse who did the intake I was having trouble drinking water and was worried about dehydration and did not acknowledge the new face hole. She got real freaked out. I know someone who did this after crashing his bike. A big blood clot fell out of his mouth onto the reception counter at the ER after he asked how much he was bleeding. Happens to the best of us. Obligatory, I'm the patient. I thought for years that I was just continually getting more and more out of shape. Despite my best efforts, nothing helped. I would just hit this wall and couldn't keep going. Eventually I couldn't walk from my driveway to my house without needing a break to breathe. Turns out shortness of breath isn't just something to wave away, it's also something I wish doctors had taken seriously. In the span of 2 weeks, I went from seeing a local clinic PA to being admitted to the ICU. My doctor told my husband he had no idea how I was still alive, nevertheless functioning. This was me with my heart problems. I literally thought I was just lazy and out of shape, but never improved despite me trying to work out more. Turns out I had literally been in heart failure my entire life. It eventually quickly tanked to the point I needed a transplant. Now I feel like a freaking superhuman because I can exercise without feeling like I'm dying. Not a doctor, but I had close calls. For a few years, I often found myself falling asleep at certain time, often after work. However, with family advice, I went to the doctors and explained the symptoms. I was checked by a specialized in autoimmune diseases, as that ran in the family. I was given an X-ray and blood work. They noticed my thyroid wasn't working. Given the second of 2 cancer scares, I was eventually diagnosed with Hashimoto's thyroiditis and psoriasis. Thanks to unusual on my skin, I was put on hormones and steroids. Likely for life. My best friend was diagnosed just yesterday with Hashimoto's. I am trying to educate myself. How can I best help her? I picked up a cookbook since she mentioned her diet must change. But I'm not sure if it's a helpful gift or useless reminder. I hope you start to improve soon, now that you've found the root. Customary, not a doc therapist part. But I don't know if I'll ever forget the moment I was told by my psychiatrist that I, 12 at the time, was experiencing emotional abuse from my mother. It was an immediate not my mother. Surely. Because at 12, you totally know what abuse is. I, 13 years later, can definitely say that I was raised in an emotionally and physically abusive household. I was the patient. But mine was kind of backwards of the whole thing. I feel like it's close enough to fit. When I lie down on my back, my feet turn out lay completely flat. They've always done this. My bones in my legs are twisted and that's the most comfortable position for them. This was the day after I broke my pelvis and I was going to the doctors to see what the damage was. The doctor didn't know about my feet. So he had this terrified look on his face when he saw me and headed back out. My mom had to talk to him and tell him no. That was normal because he assumed I broke both hips. It was more like I realized what was happening was not normal and did lead to the client being diagnosed with what I can only assume was rapid cycling bipolar II with psychotic features, was referred to a more appropriate agency after initial intake so I didn't do the official diagnosis. He came in and was so down about his life that I called in another therapist to do a suicide assessment together. Once we were going through the questions, the client became excited at having an audience and did a 180 in demeanor. I had never experienced someone flip so quickly. Aside from the mental health stuff, the client was a really cool person whom I hoped would get proper medication and go on to live a happier life. Lots of achievable hopes and dreams. And a really intelligent person. Delusions aside. Until I was 19. I didn't know it was unusual for my feet to hurt every moment of every day. A lot. I have incredibly flat feet. They literally suction to the floor and make farting noises. I assumed that, like people told me, I was just incredibly lazy. Turns out, most people didn't grow up in constant pain. Thanks. Ehlers-Danlos syndrome. Us therapists tend not to judge. If it doesn't cause significant stress and impairment in your daily life, then who am I to say it's not normal or bad? And most of the stuff we see on a daily basis isn't considered normal by most people, like hearing voices, communicating with the dead through the purchase of lottery tickets, or believing your doctor is trying to kill you. I'm a doc. It's about me. In my psych rotation, me and my fellow students were interviewing this anhedonic patient. A guy asked him, does it feel like nothing matters and that you'd rather die? I promptly responded, of course. But that's just normal. Thinking about death because there's so many bad things in the world that we know for sure are happening but have no actual way of subverting or preventing. In my mind, scenes of forced prostitution, organ harvesting, domestic abuse, serial rape, sadistic torture. They just all collectively said, no, that's not normal. If you're having problems, please tell us more. I just responded, oh, and justified in my head that it's just a lack of proper communication. I was fat. I thought my belly button, about 10 centimeters in diameter, was huge because I was fat. No one knows how long I actually had the hernia for. When it was first diagnosed, the docs tried to push it back in and it wouldn't go. I was told that due to my chronic severe brittle asthma and prescribed steroid use that I wouldn't be given surgery to fix it unless it was strangulated. 7 years later, surgery was planned for a year after another surgery. It strangulated during an exam I was videoed for. I finished the exam, and I had emergency surgery a couple of days later. My lecturer was marking the exam and noted that I went very pale and started sweating halfway through the exam. I passed the exam, although I am sure I could have gotten a medical certificate if I hadn't. As a patient, I went in for a standard sleep study because I was always exhausted. Doctor asked me afterwards if I would consider signing a release for him to write a paper on me. Apparently I moved my legs over 9,000 in the course of the night. Apparently it was RLS. I wasn't realizing I had. My wife never even told me I did it and I had no idea. She casually agreed after I told her what the doc said. I barely met the recs for moderate sleep apnea, where they will RX a machine. God, I love that thing. I sleep so much better with it. Wifi on the other hand, uses hers and sleeps with her mouth open. So annoying to listen to the air hiss out all night. I was the patient. My parents rushed me to A&E because I'd taken something like 18 paracetamol tablets in less than 24 hours. I'd read stories online about people who'd killed themselves that way. Either intentionally or not. I wasn't suicidal or anything. My stomach just hurt really bad that day. And I kept falling asleep, so it was hard to keep track of time. When I say bad, I mean absolute agony. I couldn't move. I was vomiting everything up. Paracetamol barely puts a dent in it sort of pain. And X200B. I figured this was normal pain for getting stomach cramps, i.e. from bad food. I got them a lot, to some extent every day, but the severity varied wildly. I figured I was just a complete wimp about normal levels of pain. I'd gone to doctors previously, but every time I'd been told that this was heartburn. A few times it was apparently because I had a test later in the week. And X200B. Anyway, they take some bloods and it turns out that I had pancreatitis. And have had this same condition pretty much every time the pain got so severe I had trouble staying awake. The doctors at the pediatric A&E just didn't want to take my bloods for whatever reason. I got tonsillitis a few years back. I suffered through it for about a week, but my wife convinced me to go to the doctors for antibiotics. Got there and the doctor found it weird that I had to look up to talk. I had to because that was the only way to create enough room in my throat to talk. She looks at my tonsils and says, "Yeah, we're going to have to keep you in hospital. If your tonsils swell anymore, you're going to stop breathing." I apparently have weirdly large tonsils and the swelling from tonsillitis was almost enough to close my thought. I'm not the doctor, but I found out about half a year ago that it's not normal for your shoulders to regularly dislocate subluxate. Found out after having severe pain after one subluxation. Shoulder capsula was torn, and I was asked what happened. D. So how did it happen? Me. ADK. It just happened. D. So you didn't fall awkwardly? Or got hit real hard? Me. No. It's just what happens every day, but the pain has never been this bad and this long lasting. D. So you subluxate your shoulders every day? Me. Of course. Isn't that normal? D. Okay. I'm gonna get you into the orthopedic surgeon as soon as possible. Also, I have a skin disease that only comes in male and female of 20 to 30 years old. I've had it since I was 4. During my internship I saw a polite, quiet 50-year-old lady in emergency for a pretty bad UT. Developing into sepsis. She'd been having recurrent, severe UTs for over 25 years. During her admission we had the urologist see her and it became apparent the cause of her infections was sexual intercourse. Not too uncommon if usual hygiene isn't followed. Except in this case. They were having intercourse through her urethra. I'm not sure how it was physically possible to make the mistake to begin with. Her and her husband never knew there were meant to be 2 holes there. The sad part of the strange story is that they thought they were infertile. They made the decision to adopt after many years of trying. But apparently never saw a doctor about it. I've never worked in fertility myself. But I wonder if anyone would have thought to check their technique. I didn't know how much more often I cried than the average person. Average is 1-5 Ugrave a month. As a kid. Up until I was 18-19. I cried on average 3-6 Ugrave a week. Apparently none of my teachers, parents, therapists, or counselors noticed that it was out of the ordinary for a child to cry themselves to sleep most nights. Or just burst into tears in the middle of class. It led to a lot of bullying and other stuff. And now I'm not sure I've ever been 100% depression free. I also thought it was normal to have mental breakdowns often. Like once a day near daily screaming. Breaking things. Hitting, injuring yourself. Dissociating. Honestly terrified of yourself and being alone. Insomnia. Brain actually hurts from how shitty your thoughts are. Etc. I grew out of some of it. And learned how to keep most of it behind closed doors. But I still have breakdowns a couple times a month. Some weeks. For instance the last few. I'll have one daily, or more. Turns out that them just rolling their eyes at my breakdowns when I was a kid might have been neglect. The first time I broke down in front of a therapist, not even a bad episode. For me. She recommended hospitalization. And also she quit as my therapist. Anyways, yeah, it's been getting worse again. Much worse. But at least now I know it's not a normal thing people go through. Not an oddity or habit, but I was the patient having 48 hours ambulatory EEG done over the weekend. Had it put on a Friday, go back Monday. An hour or so after it went on, I started noticing it hurting where all the legs are. I'm thinking no one told me this would be so uncomfortable. I couldn't sleep all weekend. My head was burning. I couldn't get in touch with the DR. I called the on-call DR who said that was no normal. If it was too intense, go to the ER and get it off or come in as soon as the clinic opens Monday. I waited. Paced all weekend and kept myself occupied. Monday morning they took it off. The leads burned into my skin all over my forehead and scalp. I'm apparently allergic to that metal on the leads and never knew and was having an allergic reaction. The burns were so bad and deep I had to see a plastic surgeon. Not a doctor. That thing had happened to me myself. For around half a year I had cramps each night. Lost weight. Could not tea. Had worsening eyesight. My urine smelled weirdly. My skin was extremely dry, etc. I had seen a doctor about the cramps since those were the first thing. He had recommended magnesium. But that did not help. Anyway. I went on like, that is gonna get better for almost half a year. Until I saw the same doctor once again and had him take a blood test. Turns out, I have diabetes type 1. He could not even tell me the difference between the types 1 and 2 though. So I never went to him again.